important topic from the general anatomy, and one of the very important short note. Most of the time there are many questions on this short note, is the blood supply of bones, or specifically it is asked as a long bones, blood supply of long bones. So what is the blood supply of long bones? That is the main question asked, and it is very important short note from your exam point of view. Also asking sometimes few points in the viva, and there are few MCQ points and one clinical question. Most of the time it is asked on this topic, okay, on the basis of clinical history, and then you have to answer the questions depend on the history. So let's proceed. blood supply of long bones और blood supply of bone. तो ब्लड सप्लाई ऑफ बोन में फर्स्ट सबसे ज़्यादा आता है ब्लड सप्लाई ऑफ लॉन्ग बोन. उससे पहले एक लॉन्ग बोन का टिपिकल स्ट्रक्चर क्या होता है? तो ये रहा उसका शाफ्ट. शाफ्ट में ये रहा थिक पेरियोस्टियम. ओके, तो ये नीचे इसके अंदर रही पेरियोस्टियम कैविटी. फिर यहाँ पे आता है एपिफाइसियल प्लेट ऑफ कार्टिलेज. दिस इज द एंड ऑफ द बोन. दिस इज एपिफाइसियल प्लेट ऑफ कार्टिलेज एंड दिस इज द एंड ऑफ द बोन. फिर हम ब्लड सप्लाई में आएगी वन मेन आर्टरी, दैट इज टॉर्चुअस, विच पासिस थ्रू दिस शाफ्ट एंड इमीडिएटली डिवाइड्स into a two part, ascending and descending branch, and where it goes it forms hairpin bands over there. Okay, फिर there are the epiphyseal arteries which supplies the end of the bone. So these are the epiphyseal arteries. Okay, then there are the metaphyseal arteries which supplies the metaphysis. So metaphyseal arteries, here comes the metaphyseal arteries. Okay, so metaphyseal artery, this one is epiphyseal artery, main ये nutrient artery. Okay, and then there are smaller outer aspect of the bone supplied by numerous multiple branches or vessels. This is called as the periosteal arteries. So this comes the periosteal arteries. Okay, so these are the multiple periosteal. So this is the main structure, the number of arteries supplying to the bone. Now one by one we are वन बाय वन ये हो गया. अभी इसी स्ट्रक्चर को हमें एक्सप्लेन करना है. क्या करना है? फर्स्ट हम लेंगे न्यूट्रिएंट आर्टरी, फिर लेंगे एपिफाइसियल आर्टरी, फिर मेटाफाइसियल आर्टरी एंड द पेरियोस्टल आर्टरीज. दीज आर द फोर मेन सेट्स ऑफ आर्टरीज सप्लाइंग टू द लॉन्ग बोन. सो देयर आर फोर arteries which supplies to the long bone. One is the nutrient artery, one is the epiphyseal artery, one is the metaphyseal artery, and the periosteal artery. Okay, one by one. First one is the nutrient artery. So what is nutrient artery? This is the artery which enters the shaft, okay, and the area from which enters this is the shaft, and there lies the one foramina which is obliquely placed, and the artery enters from this into the bone. So this is the nutrient artery. Okay, it enters the shaft through a foramina that is called as the nutrient foramina. Okay, and immediately in the nutrient foramina this artery divides into two branches in the medullary cavity. One goes above and one goes below. So this is the ascending branch and this is the descending branch of the nutrient artery till it goes to the ends of the shaft that we call as a metaphysis, till the metaphysis, where it anastomosis with the metaphyseal branches of artery. Okay, so nutrient artery, it enters the shaft in an oblique course. It passes through this nutrient foramina. Okay, and then it enters or pierces the cortex, enters into the medullary cavity, where it divides into two branches. One goes ascending, one goes descending, and then it goes towards the end of the shaft, and that is called as the metaphyseal end of the shaft. Okay, each branch divides into a number of parallel branches, and here all these branches are like this hairpin bend. When it goes towards the end, ascending branch and descending branch, these branches forms the parallel multiple branches, and these branches are like a bend, and this is called as the hairpin bends of the vessels. Okay, and these are nothing but the end arteries, ending of the artery or ending zone, and this is called, this structure is called as the hairpin loops or hairpin ends. These are nothing but the end arteries of the, or end branches of the nutrient artery. Okay, which area of the bone it supplies? Which area nutrient artery supplies? Okay, it supplies to the medullary cavity. Okay, and inner two-thirds of the cortex. So whatever the thick bony part is there, it supplies to the inner two-thirds of the cortex and the medullary cavity. That area is supplied by the nutrient artery. Okay, so, and where it ends at the metaphysis. It ends at the metaphysis, this zone. Okay, and so that metaphysis is the having the rich blood supply, richest blood supply in the bone is the at the metaphysis. Okay, so what is nutrient artery? Is the artery entering into the shaft of the bone. Okay, where it enters, the artery becomes tortuous in course, Okay, why this nutrient artery, when comes to the bone, it becomes tortuous? Okay, because for the movement of the मसल्स जो बोन के ऊपर मूव होगा, तो ये आर्टरी उसके साथ मूव होगी, तो इट गिव्स द स्पेस फॉर द मूवमेंट. दैट्स व्हाई इट इज अ टॉर्चुअस. विच अदर आर्टरीज आर टॉर्चुअस? ओके, one is the facial artery in the face, where the jaw movements occurs, that is tortuous, and other is the splenic artery which lies behind the stomach. Okay, and when the spleen moves with the respiration and the stomach distance, the artery, these two are the other examples where the arteries are the tortuous in course. So this is asked sometimes in viva, also MCQs. All of the following are the tortuous vessels, that is the nutrient artery, facial artery, and splenic artery. Okay, now the oblique direction of this nutrient foramina. Okay, the oblique direction is like this, so the growing end of the bone is the opposite end. So if the oblique direction is at the lower side of the bone, lower end of the bone, then upper end is the growing end. Suppose this is the bone and the nutrient foramina direction is pointing downward, then the upper end is the growing end of the bone. Okay, that is the importance of the nutrient foramina. Which is the largest nutrient artery in the body? Example, nutrient artery of tibia is the largest nutrient artery in the body. Okay, that's it. You have to write in the nutrient artery. So you have to draw this diagram. This is the nutrient artery. Okay, I am drawing it again. So this is the nutrient artery. Draw tortuous when it is close to the bone. When it pierces the cortex, enters into the medullary cavity and divides into the ascending branch and the descending branch. Then it travels through this medullary cavity towards the metaphysis of the long bone, where it ends as a end arteries, where the arteries are the having a loop like structure, and that is called as hairpin bend or hairpin loops. Okay, that supplies to the metaphysis, and metaphysis is becomes the having a most vascular part of the bone. Okay, which area it supplies? It supplies the medullary cavity, and the inner two-third of the cortex is supplied by the nutrient artery. Okay, then oblique, it enters the bone through this nutrient foramina. Okay, the direction of nutrient foramina is the obliquely placed. If it is pointing downward, then the upper end is the growing end of the long bone. Okay, it is tortuous course when it is close to the cortex before entering into the cortex. Why it is tortuous? Allow the movement of the muscle. And which are the other examples where the tortuous vessels, arteries are there? One is the facial artery, second is the splenic artery. This is the other example. Which is the largest nutrient artery in the body? The nutrient artery of the tibia is the largest nutrient artery in the body. So MCQs भी कवर हो गए. अभी न्यूट्रेंट आर्टरी भी हमने डिटेल में एक्सप्लेन कर ली. दैट एंड्स ओवर हियर. नाउ द सेकंड एग्जांपल or second artery which supplies to the bone is the periosteal arteries. So what is periosteal? ये bone है, ये इसका एंड है, ये एपिफैसियल प्लेट ऑफ कार्टिलेज है, ये दूसरा एंड है. यहाँ से हमने न्यूट्रेंट आर्टरी को एंटर किया, ये ऊपर गई. अभी ये जो शाफ्ट है, शाफ्ट ऑफ द बोन, दिस मच पार्ट. Okay, its outer layer is called as a periosteum. फिर there comes the thickest cortex. Okay, and this periosteum is supplied by numerous branches of nearby muscles. Numerous branches coming from the arteries of the nearby muscle, and these small numerous branches are called as the periosteal arteries. Okay, these are the. It enters the bone through Wolfman's canal. It enters the bone through the Wolfman's canal. Okay, which area of the bone is supplied? Outer one-third of the cortex. Mainly outer one-third of the cortex is supplied by these periosteal arteries. They lies beneath the muscle, and whatever the muscular branches are the branches coming. Periosteal branches are coming from the arteries of the muscle. Okay, then third set of artery is called as the metaphyseal artery. As the name suggests, it supplies the area metaphysis of the bone. What is metaphysis? The ends of this ends of this shaft is called as the metaphysis. Okay, so it supplies directly, this end is supplied by these vessels. This is called as the metaphysis. This is coming from the nearby muscles. These are called as the metaphyseal arteries. Okay, then the ends of the bone are called as the epiphysis, and here comes the fourth set of artery called as epiphyseal arteries, which supplying the ends of the long bone, or which supplies to the epiphysis of long bone. These are called as epiphyseal artery. They are derived from the anastomosis, or branches coming from the anastomosis around the joint. These are the branches coming from the anastomosis around the joint. So blood supply of long bone having a four vessel: nutrient artery, periosteal artery, metaphyseal artery and epiphyseal artery. एक डायग्राम ड्रॉ करना है, ये वाला, और नहीं तो ऊपर वाला, ये वाला, एंड देन यू हैव टू ड्रॉ द ऑल फोर आर्टरीज इन इट एंड एक्सप्लेन इट branch, how it is course, and which area of the bone it supplies. That's it. Okay, that four things you have to explain it. Okay, then the second type of the bone are the blood supply to the short long bones. We call it as a miniature long bones or short long bone. They are similar. Okay, nutrient artery है, it enters into the shaft middle and immediately divides into a branches. क्योंकि ये short bone है, immediately divides into the branches. Periosteal vessels supplying to the outer part and the nutrient artery supplying to the inner part of the bone. फिर आता है blood supply to the vertebra. तो vertebra का structure कैसा है? This is called as the body of the vertebra. This is called as the spine of the vertebra. Okay, then this is the transverse process of the vertebra like this, okay, and this is the vertebral canal, okay. So this is the anterior side and this is the posterior towards the spine, okay. So vertebra is supplied by first one or more short vessel to the posterior aspect of the body, ओके. सो विच इज़ पोस्टर एस्पेक्ट दिस. सो ये जो कैनाल है यहाँ से एक वेसल रहेगी, दैट इज़ द पोस्टर एस्पेक्ट, दिस वन यहाँ से, एंड दे गिव द न्यूमरस ब्रांचेस टू द बॉडी ऑफ द वर्टिब्रा फ्रॉम द पोस्टीरियर साइड, एंड दिस इज कॉल्ड एज द बेसिवर्टेब्रल आर्टरी. बेसिवर्टेब्रल आर्टरी और बेसिवर्टेब्रल फोरामिना थ्रू जो आर्टरी जाएगी दैट इज बेसिवर्टेब्रल artery, okay. Then there are the small set of vessels from the anterolateral surface of the vertebra, anterolateral surface of the vertebra, and then the another sets of arteries which supplies to the spine, transverse process and the root, this much area it supplies, that is also a third set of artery. They are mainly from supplies to the vertebral arch, mainly this much part, the transverse process and the spinous process, okay. So these are the different vessels supplying to the different bones. इनमें सबसे ज़्यादा क्वेश्चन आएगा ब्लड सप्लाई ऑफ अ लॉन्ग बोन. आपने उसको एक्सप्लेन करनी है न्यूट्रेंट आर्टरी, फिर एक्सप्लेन करनी है पेरियोस्टल आर्टरी, मेटाफेसियल आर्टरी एंड एपिफेसियल आर्टरी. ये दो डायग्राम ड्रॉ कर सकते हो आप अलग अलग, ये ऊपर वाली और ये नीचे वाली. एंड देन द न्यूट्रल आर्टरी के बारे में क्या क्या लिखना है, पेरियोस्टल, मेटाफेसियल एंड एपिफेसियल वो कौन सी एरिया को सप्लाई करती है, उसका आर्टरी का कोर्स क्या है वहाँ पे, एंड आर्टरी का फंक्शन क्या है. अपार्ट फ्रॉम दैट देन ये डायग्राम हो गया, स्ट्रक्चरली आपने एक्सप्लेन कर दिया. देन देयर कम्स द क्लिनिकल पार्ट दैट इज कॉल्ड एज द एप्लाइड एनाटॉमी. ये लिखना ही लिखना है आपको, इससे आपको अच्छे मार्क्स मिल सकते हैं. क्वेश्चन में पूछा है तो आपको ये लिखना है. एप्लाइड पार्ट में आता है ओस्टियोमाइलाइटिस. ओस्टियोमाइलाइटिस इज नथिंग बट द इन्फेक्शन ऑफ द बोन, typically at the metaphysis of the bone, okay, that is the end of the shaft. And why this area is commonly get infected, because it is richly supplied by the blood vessels, that's why it is get commonly infected. because ये जो मेटाफाइसिस है, सपोज ये मेटाफाइसियल एंड है, इसमें जो न्यूट्रेंट आर्टरी जाती है दे फॉर्म्स द हेयर पिन बेंड्स over there, and because of this hairpin bend and arteries, thrombus or the bacteria lodges over it and it blocks the arteries and lead to the less blood supply of this area or necrosis of this area, and that condition is called as the osteomyelitis. And it is very common in children because इसके ऊपर आता है एपिफेसियल प्लेट ऑफ कार्टिलेज एंड इसके बाद आता है एपिफाइसिस एंड हेयर पिन बेंड आर्टरीज. तो यहाँ पे आती है एपिफाइसियल आर्टरीज, यहाँ पे आती है मेटाफेसियल आर्टरीज. टिल द एज इन द चाइल्डहुड इन चिल्ड्रन this nutrient artery ends, hairpin bends are the end arteries, and later on when this epiphyseal plate of cartilage is gone and then epiphysis fuses with the metaphysis, then all these vessels get anastomosis with each other and the end arteries are lost. That's why in adult life there are the no arteries, no hairpin bend structure. That's why the osteomyelitis is not common in adult, it is common in children because of this end arteries hairpin bend structure of the nutrient artery which supplies to the metaphysis end of the shaft. Okay, this is the osteomyelitis. We can write in the clinical or applied part. Sometimes clinical history or the clinical question is asked in the 8-year-old boy is having a pain at a knee joint. Okay, there is a swelling over the lower end of the or upper end of the tibia and lower end of the femur. Okay, patient is gives the history of fever. Okay, and the joint pain. What will be the probable diagnosis? Condition is called as osteomyelitis. Why this condition is more common in children? Because in children, end artery branch ends at the metaphysis. These are the end arteries, and the structure of these end arteries is the hairpin bend structure in which the bacteria and the embolus or thrombus lodges over there and causes the infarction of this end of the bone, that is called as the shaft, end of the shaft, that is called as the metaphysis. And that's why the infection is more common over there and necrosis of the bone is there, and that is called as the osteomyelitis. Or other, why the osteomyelitis is not common in adult? Because in adult, the epiphyseal plate of cartilage is the growing cartilage or the growing end of the bone, and once this epiphyseal plate of cartilage is replaced by the bone, there is no growth of the bone, and this above it there is epiphysis and below it is a metaphysis, and these vessels get anastomosis with each other, so that anastomosis with each other, and there will be a loss of end artery or hairpin bend structure, and that's why the osteomyelitis is not common in adult. So we have covered one clinical short note and then blood supply of long bone. This whole topic is very important from your exam point of view. So friends, if you like this my videos, how to write the question, I have explained which diagrams you have to draw and which points you have to remember, which are the points asked in the MCQ, which is asked in the viva. Like this, each and every topic is covered. If you like my channel, please मेरे चैनल को लाइक, शेयर और सब्सक्राइब ज़रूर करना. थैंक यू वेरी मच.